A new malaria vaccine, RTS, now in its advanced stage, is set to bring hope to malaria endemic countries like Ghana very soon. Isibin Wanyami spoke with Dr. Kweku Poku-Asante, head of research at the Kintampo Health Research Center, on the efficacy of this new drug.
According to the World Malaria Report 2016, in 2015, there were 212 million new cases of malaria and 429,000 deaths. The situation is even worse as one child dies from malaria every 2 minutes. Its burden is greatest in the least developed areas and amongst the poorest members of society, although increased prevention and control measures have led to a 29% reduction in malaria mortality rates globally since 2010. Sub-Saharan Africa continue to carry a disproportionately high share of the global malaria burden. In Ghana, malaria accounts for 38.1% of outpatient department OPD cases, 27% of admissions, and 7% of deaths. Most of these deaths occur in children from 1 to 5 years. With the alarming figures, sufferers are still not able to access life-saving prevention, diagnosis, and treatment they urgently need. The introduction of RTSs will be the game changer globally. Head of research at the Kintampo Health Research Center is Dr. Kweku Poku-Asante.
The RTSS malaria vaccine is a vaccine that was developed by the U.S. Army and then also GSK. This is the first time we've had a malaria parasite vaccine. It's the first step. The vaccine efficacy can be improved, and as I speak, there are people who are working around the world thinking about how the efficacy can be improved.
Between mid-2009 and early 2014, leading research centers in Africa, including the Kintampo Health Research Center, conducted a phase 3 efficacy and safety trial of RTSs that involved 15,459 infants and young children at 11 cities in 7 countries, including Ghana, and the results, he said, was welcoming.
When we gave the vaccine to about 1,000 children within the ages of 5 to 17 months old, it was able to prevent about 2,000 cases of malaria in a place like Kintampo where malaria is very high.
Partners continue to work on next steps for RTSs along the pathway for possible implementation. The vaccine, when finally approved by WHO, Dr. Asante says, would not render other malaria intervention programs useless.
If the vaccine is introduced, it will be introduced together with the existing malaria control tools. So it is not going to replace the existing malaria control tools, and want to make sure that people continue to use their existing malaria control tools.